Welcome everybody. Today we're going to talk about the symptoms of prostate cancer that I've experienced and the side effects from the treatments that I've been given. So as far as the symptoms go, when I was diagnosed with cancer in the autumn of 2015, I could hardly believe that I had cancer. I didn't have any symptoms that I could attribute to prostate cancer. At 64 years of age, I weighed 185 pounds. I was 6'1". I was able to jog a 5K without stopping. I golfed and bowled in leagues, and I was physically active just in general. I had just started to experience nerve pains in the soles of my feet that would years later turn into what I have now and know as neuropathy. The only other symptomatic pains I had of a chronic type were very mild hand pains, where I was starting to experience some arthritis. And that was the extent of any symptoms that I had before I started taking cancer treatments. So the side effects from prostate cancer treatments go something like this. First, I'm going to tell you, I'm just mostly addressing the side effects that I've experienced. The drugs I take are known to cause a wide range of side effects, but I'm not going to get into all of those. They're just too numerous to go into potential ones. So I'm just going to talk about what actually I've experienced mostly. So since my radical prostatectomy, where they took my prostate out in February 2016, I've been impotent and incontinent. The impotence doesn't bother me too much at 71 years old, but the incontinence is annoying. I wear absorbent pads in my underwear and change them between 4 and 8 times in a 24-hour period. And it is much worse now than in 2023 than it was in actually 2016 when I started after the prostatectomy. Between December 2020 and January 2021, I had 38 radiation sessions to my prostate bed to clean up residual cancer cells. And after that, for a little bit over a year afterward, I suffered an urgency to void my bowels immediately after every meal. Within 15 minutes, I had to go to the toilet. Thank God that side effect went away after about a year. The high intensity radiation sessions I had to my right lung, caused me no known side effects. I do wonder about the tumor in my spinal cord sheath at between T8 and T9. My radiation sessions were in my right lung near my heart, a little more towards the center, towards my spine, but we won't know if that tumor is malignant or not until after I have my surgery. I do exhibit some side effects which are known to be caused by taking Lupron, which I've taken for 16 months right now. In no particular order, I currently experience testicular atrophy, hot flashes, night sweats, tiredness, and swelling of my feet and ankles. That last one is the latest one. Some side effects that are known to result from ingesting Erlita, which is apalutamide, or that I have hypothyroidism now. I've been diagnosed with that. And I have weakness of my muscles, mostly in my legs. It's most noticeable. I've gained over 20 pounds in the last year. And I'm having problems with my balance. It's difficult for me to go up and down stairs. My neuropathy contributes to this, I know. But I think the muscle weakness is partly due to the hypothyroidism and the lack of testosterone in my body due to taking Erlita and the Lupron injections. I do have one positive side effect, which is having no testosterone in my body. I get away with not having to shave every day. Two side effects that ERLEADA can cause, which I do not experience and hope I never do, are bone weakness and resulting fractures and ischemic cardiovascular events or heart attack. I recently found out by reading for this video, doing a little research, that there is no known specific antidote for an overdose of apalutamide, which is ERLEADA. The only side effect that I attribute to taking gabapentin for my neuropathy, I take 300 milligrams 3 times a day, is tiredness. Sometimes I have to take a nap. And I just started taking levothyroxine, which is for the hypothyroidism, and I've noticed no side effects due to that, but at least that I can tell. And in all fairness, the cancer treatments I'm receiving from the Geisinger staff, they're working. My PSA is less than 0.02, right where you want it. I'm still alive and I maintain a fairly active lifestyle. I'm not as active as I was, but it's still pretty good. So if you're a stage 4 metastatic prostate cancer patient, or you have a loved one who is, I encourage you to stay in the game. Try to have some fun on a daily basis, and peace. I'll see you later. Bye-bye.